Close your eyes and picture an elderly woman in her 80s with perfectly permed white cotton hair, a tiny frame, frail, with beautiful wrinkles on her face. And let's name her Dorothy. She's one of my residents at the retirement community where I work. Dorothy is 83 years old, and she's battling opioid addiction as we speak. She came to our community looking for help. She was in a car accident a little over 5 years ago. Her back was badly hurt, and she was prescribed Vicodin, a combination of hydrocodone and acetaminophen, a narcotic used to treat pain, Flexeril, a muscle relaxant, and Xanax to help with her anxiety brought on by the accident. Every one of these pills are controlled substances and highly addictive. She has been on these pills for years. The last 2 years, her addiction has gotten worse. She admits to visiting several doctors to get medications, and when she runs out, she takes a trip to the ER to get more pills. She has even stooped as to asking her husband to complain of pain to supply her with narcotics. Dorothy knows she needs help and that she cannot do it alone. And therefore, she came to us to help her with her medication management. But it has not been easy for her. She has seen therapists, church counselors, and other professionals, but she still continues to struggle every day. Unfortunately, Dorothy is not an isolated incident. There are millions of seniors going through this battle with little to no help. Nearly 1 million adults aged 65 and older live with substance abuse disorder. This could be your family, your parents, your grandparents, and it can be prevented. Today we're going to learn why it is imperative that Congress take action to address the opioid crisis among senior citizens. We are going to look at the problem, the main causes, and the solution. We have a serious problem. Seniors are increasingly becoming more addicted to prescribed narcotics. According to aginginplace.com, a resource that helps seniors navigate through their challenges of aging, they state that 35% of people 65 and older experience chronic pain, and 1 in 3 report the misuse of narcotics to ease their symptoms. The number of seniors with prescribed narcotics has increased 9 times between 1996 and 2010. And this is according to Psychiatric Times. With this increased use of opioids among the elderly, hospitalization rates for geriatric misuse of narcotics has quadrupled in the last 20 years. Opioids mentally, physically, and emotionally affect our seniors differently. Physicians prescribe narcotics like they're mints. According to Louise Arison, a geriatric author and professor of medicine at UC San Francisco, she discovered that medical school curriculum, even at top schools, still emphasizes the same core rotations with their medical students. If geriatrics was mentioned, it was an elective course. This is unacceptable, especially with the fast-growing senior population. According to the American Geriatric Society, geriatric doctors are in short supply, with only half of the 6,900 board-certified geriatricians practicing. This leaves a huge gap in specialized care for our elderly. Because of the lack of geriatric physicians and the little focus towards geriatric training, seniors are left as healthcare's forgotten community. As the result of lack of training, 15% of seniors discharged from hospitals have left with opioid prescriptions, such as hydrocodone, codeine, oxycodone. This is a major problem. When they are not adequately informed about the effects that narcotics can cause on their already weakened and frail systems. We know that this is a huge problem, but have we thought of the devastating causes affecting our elderly? There are 3 significant causes: improper assessments by physicians, absence in education about opioid effects, and the lack of follow-up by physicians. Again, physicians are not properly being taught to assess geriatric patients, resulting in errors in prescription and dosing. Senior adults do not metabolize medications at the same rate as younger patients, and it is imperative that opioids are started at a lower dose, about 25 to 50% of the dose given to younger patients. According to a study done, and this is according to a study done by the School of Medicine at the University of Nevada, seniors with chronic conditions are not educated properly when being prescribed opioids as a form of long-term pain control. Often, they're just given a printout with the effects that they will never read and sent home to try to navigate on their own. Intermountain Healthcare has been leading in the practices of properly informing their patients, and they quote, "Engaging in conversations about opioid use with their patients has been an important element of our opioid misuse reduction efforts. We hear a broad array of responses from patients during these conversations. While patients express awareness about the potential dangers of opioids, other patients benefit from additional education on appropriate opioid disposal." This brings me to the appropriate physician follow-up. It is imperative for seniors with acute and chronic pain that are being prescribed narcotics to visit their physicians frequently. This could prevent hospitalizations due to misuse of narcotics, as well as the effects that can be so damaging to seniors, such as constipation, urinary retention, or mild cognitive impairment, all brought on by dosage errors. As you can see, these effects are devastating, so let's discuss a solution. Congress must pass a law that heavily fines physicians for carelessly prescribing medications to seniors without properly educating them or considering alternative options for pain management. Making sure physicians are not only better educated on geriatric care, but also ensuring that opioid prescription is the best course of treatment for the patient, and requiring a second physician sign-off as safeguard for the patient and the physician. Requiring proper education is vital to preventing the misuse of opioids by all ages, but even most crucial by the seniors, since this population has a larger number of adverse effects. When prescribing opioids for long-term use, there must be a course on the effects and proper use of narcotics. Of course, excluding hospice patients. So therefore, today, we have learned why it is imperative that Congress takes action to address the opioid crisis among senior citizens. We talked about the problem with the improper assessments, lack of education, and inappropriate physician follow-up. We can help the nearly 1 million seniors living with substance use disorder. Remember, this could be your family, your parents, your grandparents, and it could be prevented. I hope today you have learned why senior opioid abuse is a crisis worth fighting. Help seniors like Dorothy live their golden years comfortably without the risk of falling into addiction. Thank you.